And March 11th marks 3 years since the World Health Organization declared the COVID-19 outbreak a pandemic, and there are still many unknowns about the long-term health effects. Doctors in San Diego are investigating what appears to be an increase in debilitating conditions called POTS after COVID, which usually affects women. Danya Backus has that story.
Nicole Baca was a nurse on the front lines of the pandemic. She ended up hospitalized with COVID-19 in June 2020. Since then, she's been coping with many symptoms, including heart palpitations and brain fog.
I went from being a healthy woman in her 30s to being pushed into my doctor's appointments in a transport wheelchair.
Baca was eventually diagnosed with POTS, postural orthostatic tachycardia syndrome. The disorder of the autonomic nervous system causes symptoms when a person goes from seated or a lying position to standing.
A lot of people are dismissed as having anxiety or a psychological disorder because people are not aware of POTS. We have known for many years that POTS can occur after various viral illnesses.
Dr. Pam Tao with UC San Diego Health is investigating a surge in post-COVID POTS. Estimates suggest around 1 million people have developed the condition after COVID. Treatment includes a combination of lifestyle strategies and medication.
This protocol involves strength training and non-upright exercises. And then there are medications that can be used to treat POTS and lower the heart rate.
Baca has done months of physical therapy and cardiac rehab. She continues to exercise and take medications.
Even just from in the last year, now I feel like I'm able to do more. I can stand longer. I don't have as many flares of my symptoms or my heart rate spiking.
And she took part in research studies to help people with POTS get their lives back. Danya Backus, CBS News, San Diego.